And this is the latest coming in from the Delhi High Court, where another Delhi hospital has now moved court over the lack of oxygen. In fact, multiple hospitals are making their submissions to the High Court, talking about how critical the situation is. Meanwhile, the Delhi government and the centre are also bickering in court, forcing the High Court to step in and say, stop the blame games here. One of the hospitals there said that we've already lost lives. This is the Jaipur Golden Hospital, which says there's a big tragedy coming in the next few minutes. Please help with oxygen. And multiple issues being talked about in court here to try and understand the situation at hand. Delhi High Court asks when the 480 metric tons of oxygen will reach Delhi. Remember, that is the increased allocation that the centre had put for Delhi government. And remember, Delhi government has been saying that they need more than 700 MT of oxygen as well. And of course, those are the details coming in. Delhi's Jaipur Golden Hospital says that they're gasping for oxygen. Please save lives. It's requesting the court. Delhi government is saying that they are putting in place a system. The centre tells the Delhi government, do it immediately. So all of that to and fro going on in court here. In fact, High Court has asked the Delhi government to bring in specific instances of oxygen that is being blocked. Says that definite details are needed. This after the Delhi government has said that there are the supply of oxygen to the national capital is being diverted, is being blocked. So High Court is asking for specific instances. In fact, the High Court is also telling the Delhi government what efforts were made for tankers. And also the High Court has told Delhi government that other states are arranging tankers, asking the centre how they're preparing to deal with mid-May. In fact, the High Court is saying, reports say that in May there will be a tsunami of cases. Meenakshi is joining us for more details. Meenakshi, extremely crucial hearing that is going on in court, and important submissions being made from all ends. Hospitals coming forward to put their claims and their pleas, literally begging for oxygen here. And amidst all of that, there's even been some bickering between the centre and the state government.
Well, absolutely. You have hit the nail on its head. As we saw play out since yesterday, the atmosphere between the central government and Delhi government is a bit tense and surcharged, and we're seeing that play out since yesterday. Today in the High Court as well, we saw some evidence of it. But the big news we're getting for our viewer, remember this is an ongoing hearing. We are bringing to our viewers news pegs as it is happening inside court in the virtual proceedings. So these are other aspects of the hearing that we are breaking to our viewers this point in time. Like you rightly mentioned, at one point in time, the High Court pulled up or reprimanded the Delhi government when it was informed as to how all other states are making respective arrangements of tankers to transport oxygen, and the Delhi government thus far has not been able to do so. So the High Court asked for the Delhi government to be in constant touch with the central government authorities. If it does not have a tanker, why has not been a tanker made available for the transportation of this oxygen? That was one of the queries on which Delhi government came in for a bit of scrap at the hands of the High Court. But importantly, as we speak, the ongoing discussion, like you rightly mentioned, is about what the month of May entails. The High Court said that it has read reports. It wants to understand from the central government what the government's projections are, because like you rightly mentioned, Ami, the High Court says that as per reports, there will be a tsunami of cases. The High Court wants for the mortality to be reduced significantly in India. Whatever needs to be done, if a person can be saved from the jaws of death, that effort has to be made. So the central government is being represented by the solicitor, where we are seeing the solicitor tell the High Court that everything is being considered. The solicitor went on to add that he is praying that it doesn't come true. There may be, however, be a rapid rise, but he's saying that the government is ready for the worst. He does not want to create panic. He said that the message has gone from the Prime Minister and the Home Minister to suppliers that if they send oxygen to only chosen parties, they would straight go to jail. That is one of the submissions that the solicitor is making before the Delhi High Court. He is also adding that 50K metric ton of oxygen is being imported. Other areas are also being augmented. Wherever possible, oxygen production is being tapped. So these are some of the measures that the solicitor is highlighting before the Delhi High Court, when the Delhi High Court asked this question of the central government, how it proposes to tackle a tsunami-like rise in cases in the forthcoming month of May.
Absolutely, Meenakshi. And if you can also just give us a sense of how many hospitals are making submissions in court at this point in time, who are all the parties present?
Well, Avi, so far we have seen the Agastyan Hospital and the Jaipur Golden Hospital, two of them cite their difficulties. The majority of the arguments are taking place between the central government and Rahul Mehra, who is the senior advocate representing the Delhi government. And the issue here is that despite the allocation of oxygen, the oxygen supplies are clearly not reaching Delhi. So the central government is saying that the Delhi government should stop the blame game of sorts of I versus you. It is a collective situation which needs to be dealt in a collective manner. And this is when the discussion then veered towards the aspect of how the Delhi government is not making arrangement of its own, as all other states are arranging tankers for the transportation of oxygen. The solicitor is of the opinion that there is clearly some communication gap somewhere which needs to be plugged. So 2 hospitals have submitted so far, but remember, this is a long list of hospitals that are coming to the High Court to procure their supply of oxygen. But this oxygen, the allocated quantity of 480 metric tons, has to reach Delhi for it to be transported to various hospitals in the city of the national capital. But that being said, this new aspect of Delhi government being the authority to arrange for tankers has also just emerged, where the High Court is pulling up the Delhi government for not being adequately in touch with the central government authorities if it does not have a tanker, so that necessary arrangements can be made.
All right, Meenakshi, thank you so much for joining us with all of those details that hearing on at this point in time. We'll keep track of what exactly comes out of it. And this is Metro Hospital now in Preet Vihar, which has started calling the attendants to get their patients discharged because there is no supply of oxygen. In fact, those are the latest details coming in. This is from Delhi's Metro Hospital in Preet Vihar, which is also now citing lack of oxygen, and they are starting to discharge patients because they're left with no other alternative. In fact, in some of the other hospitals here, we're talking about more than 20 people who have lost their lives in Delhi's Jaipur Golden Hospital because of the lack of oxygen. Most of them were admitted to the critical care unit and were COVID patients, and they have lost their lives. The hospital said that it only got 40% of the supply that it actually needed. All right, we've in fact got Dr. Ashish Chaudhary, the MD of Akash Healthcare from Dwarka in Delhi, who's joining us on the phone line. Dr. Chaudhary, thank you so much for taking the time out and speaking to Mirror Now. I can understand how difficult the situation must be that you're facing at this point in time. Give us a sense of what's happening right now.
So, in our hospital, the occupancy of COVID patients is already more than 200. And as it is happening in most of the hospitals, we are also facing that crisis of oxygen for the last 4 days. In fact, every night we are worried till what time our liquid oxygen plant will continue. So we are going from pillar to post. Our security and administration team is going to the vendor's place, trying to request liquid oxygen and refilling of the D-type cylinders for the benefit of all those patients which are admitted here. But every day, after every 12 hours, we are running from one place to the other. So situation is not very easy here. In fact, in last 2 days' effort, we could, manage supply for at least next 18 hours. So I think we are good to go for today, but we are not certain about the night and the very next day. So it's, a very fluid situation, and we are trying to match up with the demand by trying to get oxygen from various sources.
Right, Dr. Chaudhary, so it really sounds like many of the other hospitals, rather most of the other hospitals, it is really a hand-to-mouth situation that you're facing right now. For now, you say that you have sufficient oxygen, but you don't know how, through the night, how it's going to proceed. But if you can help us understand right now, what is the process that you're following? Because we're seeing many hospitals like yourself raising SOS messages, putting out video appeals as well. But what is the process that you are trying to follow right now in an effort to try and get hold of oxygen?
Ma'am, the usual process is to, we have been assigned a vendor who supplies the liquid oxygen as well as the cylinder oxygen to our area. But that guy is not able to meet up the demand. So he has already raised his hand that I cannot fulfill the demand. So what we have done is we have tried to find out various vendors, especially from non-medical industries where, they are generating good quality oxygen. So we are, trying to reach out to them. There's hardly any process which is left here. So wherever we are finding a resource, in fact, we have gone as far as Yamunanagar and Ludhiana and, even Jaipur, we have requested Jindal Industries to supply some oxygen to Delhi hospitals. So they are helping us a lot, trying to, create a green corridor for various oxygen tankers who are moving from these places to Delhi. And, we are trying to get a small share out of that so that we are, able to continue the, treatment of patients without any fail because of the oxygen shortage. So it's hardly any process left. Wherever we find some ray of hope, we, push our team to go there and try and get handful of oxygen or some kind of, refilling of our cylinders. In fact, the cylinder refilling time has gone up by more than a day. So we have to stock at least 3 times the requirement of the cylinders so that, even if there is a delay in the refilling, we are still able to manage the patient load and their oxygen requirements.
Right. Dr. Chaudhary, the other question, of course, here is that we keep hearing when we speak to the, government's people, representatives, saying that they've set up various helplines and they've set up a war room and there are nodal officers in charge to sort of handle such SOS situations. What happens when you try any of those methods to raise the SOS?
Ma'am, to our rescue, a lot of government agencies, they issued directives to various distributors to supply a minimum amount of oxygen per day. But the thing is, the process and the handling and the production capability of the plants around Delhi was never, very great. So that even if the order has been passed by the government to help us, but the vendor is, the production unit and the distributor is saying that they don't have the capacity, they don't have the distribution network to actually supply or meet up this increased demand of various hospitals. So I think the effort from the government is also there, but the problem is there's not enough production happening in the medical gas pipeline area, and also there's not even a robust distribution system who can supply to the hospitals at regular intervals so that they can continue the care with uninterrupted oxygen supply. So I think there's a lot of overhauling required in the production as well as the distribution network. They need to ramp up the production. Right now, the steel industry is helping us, divert the oxygen to the medical, industry. But the problem is that is just a, firefighting method. But I think the government has to take a real initiative to increase the production so that in future such a crisis can be managed, more effectively, and we don't lose lives just because of shortage of oxygen.
Right. And Dr. Chaudhary, one final question, just to understand the amount of, oxygen that is being required. If you can give us a sense of earlier on, before this oxygen crisis and before the second wave, how much oxygen was being required, and right now, how much oxygen do you require on a per day basis?
So if I, talk about the period between COVID-1 and COVID-2, so our 2 metric ton oxygen was being, used for almost like more than 24 to 30 hours, would suffice for up to 30 hours of production consumption. But now that tank of 2 metric ton is getting over within 10 to 12 hours. So it's almost 3 times the consumption has increased.
All right, Dr. Chaudhary, thank you so much for taking the time and speaking to us. There's a hearing on in High Court. We do hope that the situation progresses and gets resolved at the earliest and the supply is restored. Thank you for speaking to us. Alok also joining us now at this point in time. Alok, you just heard, the MD of Akash Healthcare there citing the entire, he practically is saying that there is no process left. So whatever the government is telling us, whatever, we're hearing about war rooms and helpline numbers being set up, the hospitals on ground are clearly saying that there's no process left. They have to try any and every method to get the oxygen on their own.
See, Avni, as far as my research is there, because I am also working on various aspects and why this basically the chain of demand and supply should happen, but it's not happening. Why it's not happening? I was also trying to get the reason, and what I found out as of now that there is a nexus that was working previously, and in fact till now as well, between the dealers and the suppliers, and as well as basically those who are hospitals. And because there is a huge demand of this huge demand of oxygen now is there across the national capital, and that nexus is now somewhere trapped in that thing. And because they know that the government is now taking over all the process now, because it's now being properly looked after by the government, and the requirement is huge. So now that nexus has broken down, and because it has been broken down, so nobody knows where is that chain going, and where is that chain starts and where it ends. So this is what is happening. Remember, in the national capital, this oxygen comes from 2 places. That one is directly from like Linde or Inox kind of plants, which are basically established in Punjab, established in Haryana and Uttar Pradesh. And also there are refillers who are working, who are operating in the national capital at various industrial areas. These refillers usually takes money from the hospitals and directly send the cylinders to them. And on what cost they were sending cylinders to them, I don't know. We also don't know. It's a nexus that is operating between the dealers and the refillers, and also the hospital as well. But now, since the demand has increased, suddenly that demand has increased, so that nexus has trapped somewhere what they have to do and what they should do. And this perhaps is the reason this kind of problem, chaos, mismanagement we are seeing, despite the setting up of war room or something this kind of helpline. Government is also not understanding what to do. Different places there are they are now doing raids at various places where these people, basically those who are dealers and suppliers, they have in fact stored these kinds of cylinder in their storerooms, and they are not supplying. In the view of that, they will sell it in the black market uh, or higher money. So all these things are there. Definitely mismanagement is there. We hope the things will streamline, because the government has already taken over the whole process. In fact, very interesting point I would like to make, that whole year was there that Delhi government did not bother to think about the whole process of giving these oxygen to the hospitals, how it works. Nothing was done, and now suddenly the oxygen demand has been increased. So definitely now the Delhi government is struggling to streamline the process.
Absolutely, Alok. Thank you for getting us all of those details and explaining that entire supply chain and where that deadlock really is, the bottlenecks are. But multiple hospitals here, besides the Jaipur Golden Hospital, there's a list of hospitals which have put out SOS messages. Batra Hospital raised an SOS saying it received only 500 litres of oxygen against a requirement of 8,000 litres. Saroj Hospital is refusing new admissions and discharging patients as well due to the oxygen shortage. LNJP Hospital as well said it did not know how long its oxygen stock is going to last. Delhi's Moolchand Hospital also flagged off an urgent requirement. And remember, Delhi government has set up a nodal office to coordinate this, but the health infrastructure continues to be overwhelmed. In fact, let's go across to Dr. S.C.L. Gupta, MD of Batra Hospital, who's joining us on the phone line as well. Dr. Batra, thank you. I beg your pardon, Dr. Gupta, thank you so much for joining us on Mirror Now. Help us understand, you also raised an SOS with regard to the oxygen requirements. What is the situation right now?
Situation in Batra Hospital, morning there was an emergency declared by Batra Hospital. There was no oxygen. At about 8:15, we had started this oxygen only to the serious patients in ICU. We had given oxygen to ICU. Rest was on a cylinder supply. We received about 500 liters of oxygen at 9:30, which is finished after 1 hour. Since 10:30, 11 o'clock, which is 1:30, we haven't received any oxygen from anybody. We are running our ventilators by cylinders oxygen. Now, one patient is getting about 25 ml of oxygen per minute. For how long this thing is lost, God only knows. And situation is totally very, 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 very serious. Anything can happen anytime. And yes, we cannot excuse ourselves. Very, very bad situation, man.
Yes, absolutely. Yes, Dr. Gupta, thank you so much for joining us. And we hope that all of these voices reach the people they're supposed to and things ease up, at least in terms of the oxygen supply.